Case shining a national spotlight tonight on patients and their doctors and what happens when you sense that your doctor could be administering something you don't need. Tonight, a very serious case, a Michigan doctor accused of giving chemotherapy when it was not necessary. Here's ABC's Lindsay Janis now.
Dr. Farid Fata is behind bars tonight, charged with the unthinkable, mistreating his cancer patients in order to bilk Medicare for tens of millions of dollars. Federal prosecutors argue the 48-year-old oncologist gave unnecessary chemotherapy to patients in remission and fabricated diagnoses in order to perform expensive tests. And tonight, relatives of his alleged victims are speaking out.
My father, Milton.
Jeff Burrs says that when his father didn't respond to chemotherapy, Dr. Fata refused to stop administering the drugs.
They were giving my father transfusions in the parking garage area, and what kind of a practice is that?
Fata's attorney says his client is innocent.
The government has not retained an expert to give an opinion that there was a mistreatment or misdiagnosis or unnecessary tests given to any patient.
But others suspected something was wrong as far back as 2010.
Things were being administered and infused incorrectly.
Cancer nurse Angela Swantek says she first complained to investigators after observing employees at Dr. Fata's clinic.
To know that a doctor could have potentially brought your death on sooner is sickening.
A year later, Michigan's licensing board told her it could not prove any violations and closed the file.
Well, we spoke to some doctors who told us patients should always ask what the standard protocol is for their diagnosis. And David, they should never hesitate to get a second or even third opinion, especially if it's cancer or surgery.